Come on. Morning, everybody. Welcome to the Jefferson County Health Department Board of Trustees meeting. We are now live, and today is May 24, 2024, 9 a.m. meeting. I know there's some confusion, but we had to change the meeting due to a number of conflicts. So we're off and running. We'll call this meeting to order. Roll call, please.
Mr. Pig,
I'm here.
Dr. Henry. Here. Ms. Stidham. Here. Mr. Deal.
Here.
Ms. Taylor. Here.
Dr. Henry, would you please read our mission, vision, and purpose?
Sure. JCHD will champion positive health outcomes and behaviors through innovative programs and community engagement. The vision is advancing the health and safety of Jefferson County. And the purpose of the health center is to establish, maintain, and operate for the improvement of the health of all inhabitants of Jefferson County.
Thank you very much. Need approval of the agenda, please, as presented. Or if there's any.
Make a motion to approve the agenda.
I second it.
Having first and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Yes, today. We have a lot of staff. We're trying to make this painless as possible. Next on the agenda, approval of the April 25th, 2024 meeting minutes.
I'll make a motion to approve the minutes.
First and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Next is approval of the April 2024 expenditures of $78,769.82. Do I have a motion?
I make a motion to accept expenditures.
A second.
First and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Approval of the 2024 electronic payments for $491,000. Well, excuse me, $491,109.79. Do I have a motion? A second?
I second it.
First and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion does carry. Next is pre-approval of the June 2024 electronic payments for $602,804.08. I have a motion.
Yes, I, motion for June.
Second.
First, thank you. First and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye. Aye. Any opposed? Motion carries. Thank you. Mr. Sykes, Director's Report.
Okay, in April, several of us, the leadership team, admin team, went to the Missouri COVID-19 Lessons Learned Conference, and it wasn't really just centered on COVID itself, but just some of the things that people learned, health departments learned of how to operate during some type of a pandemic. And we did learn a lot of things that I think improved our department. And there were several things highlighted at this conference that we went to. So it was really well accepted. That was in Jeff City. I can't even remember where I go half the time. We also had a new board member orientation. Valerie came and met with the leadership team, and we went over our programs with her. I think that was well accepted. You had a lot of good questions for us as well. Took a tour of the facilities here. Also, I think I touched on this last meeting about our PEOC, Public Health and Emergency Operations Center that we have. That's our internal emergency center. And we did an exercise in April, and we thought it'd be good. This is something we have to do anyway as part of our preparedness. And so Gina and Anne Marie here with the health department, put together a scenario that we worked through with our team. And we had this over at the County Office of Emergency Management, or at Hurricane. And the scenario was a measles outbreak. And we didn't do this to create a scare in the county. This is just us preparing for something that could happen. It may not be measles, it may be something else. We responded when there's floods in the county, and this could even work for that. So again, we're not doing this to scare the public about this gloom and doom. It was just our internal training. And we had our OSA staff, our clinical staff, admin, we're all there. Valerie came and was part of it, observed, had some, again, good questions. I hope she thought it was a good
I did.
exercise.
I did, enjoying myself.
We had some evaluators come in and look and watch our exercise as well from other agencies. And just some observers that watched what we did as well. And I think it was successful. We found a few gaps, and that's what this exercise was all about, was to see how we can improve our plan to respond to these types of emergencies. Another thing I have on our director's report that came out of our last meeting is the possibility of using iPads for board members. So Tim asked for me to put together something for you all, which I passed on to Mr. Berry with our IT department, on possibly using iPads, distributing iPads to the board members and having email addresses that they could use on those. So we put together, there's a spreadsheet I think I gave each of you. Tammy, did I give you one?
Oh, wait.
So, yeah.
It's yeah, I got it.
So the idea of this would be that the iPad would be part of our stock that we would loan to you as a board member while you're on the board, and that you would have a JCHD Jeffco Health email address. And so Steve put together the cost of doing this. The idea here would, he did put on, like, if we provided the data, internet access, that makes it a little more costly. And we felt like, you can just use your own access, your own wireless or whatever type of internet access you have, but we would provide the iPad and the email address to use. That way, you could even use the iPad without the paper if we wanted to go that far at our meetings. And just look at it on, that's a lot of paper being printed out every time. We brought a couple of iPads that we use, different sizes.
This is on the notation on your paper. This is the 10th generation iPad 64-bit. If I can figure out how to open the case. So it's a little bit smaller, but I think it would be good to read board packets and still send emails from. And then the more expensive versions were the iPad Pro 12.9 inch at either 128 gigabytes or 236 gigabytes. A little bit bigger. The resolution's a little nicer on these, but again, if you're only doing email and checking board packets, the other one's probably sufficient.
So I know the question or the issue you had, sorry,
Yes.
I'm sorry. I know the heartburn that you were having was us having our own individual and not really, either going through our phone or going through another access point, and that gave you a lot of pause for concern.
Yeah.
I presume this alleviates a lot of that, not all, but I understand that
Yeah.
still.
There's still some security.
The training still, if you click on it, no matter what, you click on a
Yes.
nefarious email or something,
Yeah.
things can happen.
But it does alleviate some of the concern of mixing personal and work.
Well, I know you're more concerned with the security end of it as
Yeah.
far as with that.
Yeah.
But, okay.
We have other clients, by the way. There are apps out there that are designed to, they integrate with iOS, and they're designed for board packets so that you can preload board packets and all your spreadsheets and your tabs and all that stuff and have your minutes available on them. closed and open, that's only accessible by the board members. So there's lots of apps out there that can help if you were to go to this type of an option instead of using the paper packets.
Now, of course, this is an unbudgeted thing, but I brought Kristen in to have some funds we can do this with, but it'd just be a matter of, is the board in favor of doing this, and what do they want to go with, or is the size of the iPad? Do you want internet access, or you be responsible for your own internet? Because that is a fairly significant cost.
Okay, okay.
Thoughts?
I'm okay with using your own Wi-Fi or whatever.
I think it's unnecessary to pay for internet access, and I think it's unnecessary for an expensive iPad too, because we're not doing imaging or anything like that, we're just looking at board packets, so it doesn't need all that memory. We need to get him a big. The rest of us, you don't remember in retirement. We can go with the little one.
And you can still zoom in on any.
Accessibility option.
So the small ones is the less expensive ones?
Yeah, so the small ones, they are $499.99 a piece. So for the 5 of you to get the hardware cost alone would be $24.99.95.
Some dollars, the difference.
Yeah.
Well, I think the security of it, having it available all in one place, I mean, I don't know. I think it's a good idea, but I'll let the board tell me what they would like to do, and do we really need to do anything other with this other than just give an okie dokie?
Yeah, it's an expenditure that it's below Steve's level of purchase.
Does anybody have anything that would say no to this? Does anybody have a problem doing this?
Not to say no, but I know there was one stipulation I saw. It says when someone's term is over, it gets turned back in,
Absolutely.
which makes sense.
Mhm.
What about if somebody loses it or breaks it or whatever? Are we gonna?
Is it, since it belongs to the health department, would it be covered by whatever insurance plan that you have for existing electronics, or would the individuals need to buy their own like Apple Care for it?
We normally do not provide Apple Care for any of that. So yeah, if you would be interested in purchasing it, I don't know if that would be necessary. Because a lot of times they have like a built-in base warranty on them. But it really just depends and it varies per device.
We make it if you break it, you pay for it?
I mean, I'm for that.
But me, I want to be a little lenient with that
Yeah.
because,
What
if somebody breaks it,
would you guys do if you lost it?
Well,
If it was a staff, like,
if it was staff, the first thing I would do is reach out to Apple and make sure that anything with it gets shut down.
okay,
But we would look into replacing it, or if there was warranty or loss sold with the purchase. It depends on the purchase date. If it's 5 years old, Apple's probably not gonna do. But if it's a couple months old, we have some more leniency.
It also depends on how did it get broken? Like, was it because you were, did you leave on top of your car and pull off? Or was it stolen out of your car? We've had an issue, I thought a couple of years ago, where something got stolen out of a car and we had to file a police report. We went through it that way in order to turn in our insurance as a stolen item. So that wouldn't be like an Apple Care issue, that would be an insurance issue. So I think a lot of it depends on like, how did it get broken?
so this is an Apple product that we're gonna be getting?
Yeah.
Does anybody else have Apple products in here? I'm talking about the board, okay. Does it have, can we activate, does it have like the Find My Phone? Can you have that on the computer as well?
Yeah, they can have those, yeah.
That'll be a big help for, I think it needs to be on there for all of us. And I know it can be, there's certain things you can do, but I think it helps you be able to.
So, and that is another point of topic. So when current procedure for any iPads that we have, I build the Apple ID, that way I have access. If you guys get locked out, it will send me an email and get you back into it. So if you have a current Apple account, I wouldn't want you to put your personal Apple
Right.
account on it.
Right. No, I think it needs to be definitely separated so we all understand that this is, it's an item from the health department's item that we're gonna be using. It's assigned to us like anything else would be assigned to any other staff member. And that it's not ours technically to do with, and that people are gonna have complete access to it. Yeah, things on there are not private, I guess, again, point. Correct. And if nobody has any objections, then I think that kind of gives you guys a direction of where we need to go. Oh,
I'd have to look into that, sure.
all right, Steve, anything else you have?
So is that
Move forward.
yes? Okay. Think I
With
had, oh, yeah.
With the least,
The
smaller.
And of course, before we give you the email, we have to get that training.
We'll get the
complete as
training.
Well,
We'll
so I think we've got dates.
Finalizing dates.
Real quick, we did have some hail damage, sustained some hail damage here at the health department. I think 2017, we had a storm that's very similar to this and had the same results. So we have close to 20 cars that took a hit, and our HVAC units took hits to the coil pins that are exposed. The hail just completely mashed those in. So the units work. It's just that those will either have to be replaced or combed out. There's a couple of units that the insurance adjuster recommended we just replace. They're just so old, and finding parts for them would be difficult. So we're still working through the numbers. There's actually an adjuster here right now with the roof. It's a separate, so the cars was one adjuster, HVAC was another, and then the roof is yet another. So Mr. Crawford's been working on that, and the numbers are coming in. The vehicles, we'll work with probably a local person to get the hail damage repaired on those, because that's a lot of vehicles to have that much damage to. They're still very good shape vehicles, so we want to get that fixed. And I don't know.
Those have deductibles all on them too, so.
Yeah, that'll be,
Cost us $20,000.
well, we shouldn't have anything out of pocket, because I think what the cost, they'll just remove the deductible from the total
Okay.
that they've reimbursed us, so. And probably with like the HVAC units, we're talking a huge amount of money. We don't know for sure what that final figure will look like, but they'll only give us a portion of it up front.
Mhm.
That way, if we don't do everything, they're not gonna give us the rest. So my thought is we would replace those units if they say replace them, and they'll pay for them, but we'll look at that. We're battling that thing. We're not gonna be in this building much longer.
Right.
How much work do we do? But I'd hate to get to the middle of July. We're still here in July and
Right.
they're not working right, yeah.
And it'd be a problem if we try to sell it too.
Yeah,
So we may end
yeah.
up fixing it anyway, so.
Yeah, I don't know how much return we'll get when we resell, but it can't hurt. So, we're looking at that now. And then finally, I don't know if we mentioned this yet or not, in June, the mosquito control season will start. And that's where we do the adulticide spraying in the unincorporated part of the county. And then in some of the cities that sign agreements with us, we will do spraying there as well. But not just spraying, there's also the trap sites that they monitor, and they collect mosquitoes and determine and check for like West Nile virus, things like that. And by doing that, if you get a positive, they can go to that area and treat again or treat for the first time, just depending. It's a better way of using your treatment spray. So that's going on. Hopefully in June is when that program will start. Anybody have any questions?
I know that the mosquitoes seem to be a lot worse this year. I've got them in my house, and I've probably ever had my house in this year, that's all one. And I think it's because cicadas and all the birds are cicadas. Not either.
Thank you.
Enough said.
It's great in here.
Chocolate. Okay. Steve, is that was interrupted with anything else you guys, sir?
Good. It's a good way to end.
I know, I would have thought.
So on our agenda next, public comments, there's nobody here for that. Go ahead with old business. We want to talk about new building, old business, new build. It's a lot of work. Because you're spending money. I don't know what I do with my report. Would you like my copy, new building report?
I'm getting there. Sorry. All right, so we had a meeting yesterday, so this report's a little old compared. I got updated news. The project completion date has been moved into April. Hopefully, when the weather breaks, they get the concrete poured and we start actually putting the building. When it gets on the roof, things will go a lot quicker. So the builder and our architect, they're hoping that some time will be made up later, but right now the date is pushed back into mid-April. But they do have a lot of the exterior footings poured, and they got a lot of the plumbing that has to go in the ground prior to the floor being poured. They've got that going. The electrician's supposed to come in next week, start on his part that would go in the below the floor. So all that has to be done before they actually pour the slab. And then so I think they said we have a timeline, probably end of June, we should have a floor there. If I understood it correct. So it's just a matter of the weather that we're having. It's been really wet. They are putting in the stormwater drains and all the piping for that. And once they get that in the ground, they can start moving a lot of the dirt that's piled up on site. They can move that to build the elevation up and then continue digging a trench for our utility lines. Working on our furniture, I think we're getting close to having that all completed. That's been kind of a group effort with the admin team. Picking out desks, chairs, things like that. Next, we're working on the IT aspects of things that we are responsible for doing on the new building. And so we're working on the devices that we need to purchase, how we'll work with our current providers like Windstream or other companies, how we'll move their operation over to our new building. It's all going to have to be coordinated for that. And then we also are responsible for the signage, internal signs, the signs on the building, and our monument sign we're going to have. So that's another project that we have to work on.
This, were we gonna have a sign out on 21?
No, not this time. We're going to put a monument sign there at the entrance to our building. And we can talk to the owner of that site and see. There was discussion of maybe having they may have a huge sign with all those businesses that are in there, and they might go on that. We're not going to do another electronic message board like we had at Hot Ridge. That was a huge expense to do that. So, and where we're sitting, we didn't think we're probably not going to go with a message board right at our office. It'll probably just be an actual Jefferson County Health Department sign, just because of our location. So finances are on here. Any questions on the building? Again, if you ever want to go down. Right now, it's probably not a great time, but at some point, take a tour if you want. Just let me know. You can go and park at the other business there. You can see some of what's going on. Just don't walk down there. That puts you to work.
Say the completion date was pushed to April instead of March.
Yeah. I wrote this for the board packet,
Right.
but our meeting was after, and they gave me an updated timeline.
Too much rain.
So that's the building report.
Questions? Good.
Oh, it's right there.
I believe the next on the agenda is a closed session. Would somebody like to make that motion? Ronald suits.
Closed session.
Pursuant to 610.021. Any confidential privilege communication between the Board of Trustees and Jefferson County Health Department, non-representatives and attorneys. And all records and protected and disclosed by law. So we have a first and second, any discussion? Hearing any, roll call vote, please.
Mr. Pig,
Yes.
Dr. Henry,
Yes.
Ms. Stidham,
Yes.
Mr. Deal,
Yes.
Ms. Taylor.
Yes.
Hey, back.